The prospect of level 5 restrictions for the next 6 weeks is a pretty grim prospect. The normal social and human interaction that is the lifeblood of people is going to be, to a very significant extent, curtailed, and yet it is necessary for a very simple reason. For anybody who doubts that, and there are a few who doubt that it's necessary, it is necessary for the very simple reason that we cannot put our doctors and our frontline health workers in a position where sick people, either with COVID or with non-COVID related sicknesses, arrive at the hospital and there is not an intensive care bed for them, or there's not the staff and the healthcare provision in order to look after them, and they have to be turned away. That prospect is unthinkable, and whatever one thinks about the handling of the COVID pandemic, we simply cannot put our doctors, our healthcare workers or sick people in that position. And so for that reason, we have no choice but to impose restrictions in order to try and drive down the infection rate of this virus. Having said that, I do not agree with the coercive approach that the government is trying to apply in terms of fines, powers and so on to act against people who they deem to be the problem in terms of sustaining the public health effort. When the first lockdown happened, there was absolutely overwhelming support for it. There was no need for compulsion. People did it because they knew it was necessary. And the vast, vast majority of people, as difficult as it is, economically, psychologically, socially, and in every other way, people will endure the hardship in their overwhelming majority. But the subtext or underlying logic of this extension of these coercive measures and fines and so on that the government is proposing was kind of summed up by Deputy O'Dowd when he said, you know, it's some people's irresponsible behaviour is the reason that we are in the situation we're in now. That is not the reason we are in the situation now. The reason we're in the situation we're in now is because, for example, the government is exploiting student nurses because it hasn't staffed our hospitals properly, because we have critically low levels of ICU, some of the worst ICU provision in the Western world, because we won't pay our contact tracers properly and fail to recruit the contact tracers that we need in order to chase down this virus, because we didn't act against the meat processing plants, no fines issued there, and a whole range of other failings by the government itself, and critically failings to support the people who actually are seeing their livelihoods hammered by this pandemic. So we say reward people, support them, don't punish them.
Thank you, Deputy.